Okay guys, today this is my first video on my channel, and all comments, criticisms are welcome. You can put down in your comments. So today we can talk about autoimmune hemolytic anemia. So what is autoimmune hemolytic anemia? It's basically an acquired type of hemolytic anemia. Hemolytic anemia in the sense red blood destruction occurs inside the body from the antibodies that were produced by our body itself. So basically we can classify it into warm autoimmune hemolytic anemia and cold autoimmune hemolytic anemia. So we'll look at the differences of both of these types now. So warm autoimmune hemolytic anemia occurs at 37 degrees Celsius, that is our body temperature. So warm autoimmune hemolytic anemia, the antibodies are usually IgG antibodies, which are like the antibodies that are produced at chronic stages of infections. So similar to that, these antibodies are IgG antibodies, and because of that, these IgG antibodies cannot cause intravascular hemolysis. They can actually activate the complement systems only to a certain extent, not like in IgM antibodies. So because of that, the hemolysis in warm autoimmune hemolytic anemia occurs in the extravascular spaces, that is the spleen. And then this in warm autoimmune hemolytic anemia, the Coombs test is strongly positive. Direct Coombs test. Coombs test means it is a test to identify bound antibodies in the red blood cells. So when you put in this Coombs reagent to this sample of blood of a patient who is having warm autoimmune hemolytic anemia, it will show positive. And according to any other disease, similar to any other disease, this warm autoimmune hemolytic anemia can be divided into primary and secondary disease. If you cannot find a cause for this warm autoimmune hemolytic anemia, you call it idiopathic. And if there's an underlying cause, that means an autoimmune disease such as autoimmune rheumatic disorder, SLE, chronic lymphocytic leukemia, lymphoma, Hodgkin lymphoma, or any other carcinoma can be associated with secondary warm autoimmune hemolytic anemia. And certain drugs such as this methyl dopa, penicillins, cephalosporins, NSAIDs, quinine, which is an anti-malarial drug, and interferon are also associated with autoimmune hemolytic anemia. And then as in any other autoimmune disease, this warm autoimmune hemolytic anemia is commoner in females. Like females, usually autoimmune diseases are more common in females, and similar to that, in warm autoimmune hemolytic anemia is also more common in females. And investigation wise, you can see on blood picture spherocytosis. Why is that? Because this immunoglobulin bound red blood cells will lose their membrane when they go through this spleen. So when these membranes are removed from the red blood cell membrane, they lose their donut shape and they become more spherical, which will be shown as spherocytosis in the blood picture. And direct antiglobulin test, that is this direct Coombs test, is positive with IgG alone or IgG and complement or complement alone. Any of these can cause DAT positive. And hemolytic anemia is evident on blood picture. And because of these autoantibodies, sometimes you can also develop autoimmune thrombocytopenia, that is reduced platelets, autoimmune neutropenia, that is reduced neutrophils in the blood. So it is more or less similar to this pancytopenia, right? So this autoimmune hemolytic anemia can also give a similar picture as a pancytopenia patient. And autoantibodies for E antigen is positive on investigations. And on management wise, you give low dose prednisolone, which is an anti-inflammatory drug, 1 mg per kilogram per day for remission. And second line treatment is splenectomy. As you know, as I mentioned earlier, this is a type of extravascular hemolysis. So because of that, when you do splenectomy, patients may get cured. and if fail, you might have to go for high-fi drugs such as azathioprine, rituximab. Rituximab is a CD20 inhibitor, which is a monoclonal antibody. So the CD20, as if you all can remember the pharmacology, it is a molecular membrane that is found in B cells. So when these B cells are inhibited by rituximab, the antibody production is inhibited. So because of that, this autoimmune hemolytic anemia can be treated by rituximab, and you can do blood transfusion in this patient if it is very severe, but we have to be cautious because of this auto antibody bound red blood cells. The compatibility testing can be altered in these patients. So because of that, there's a chance of transfusing wrong blood groups to these patients. So to prevent this, you might have to be cautious. And now we'll move on to the cold autoimmune hemolytic anemia. So warm occurs at 37 degrees Celsius. Cold occurs at 4 degrees Celsius, which is like at a colder temperature. So when a patient from a warm environment moves to a cold environment, he can develop a cold autoimmune hemolytic anemia. Specifically, it occurs at around 4 degrees Celsius. So practically speaking, our body, the core body temperature is around 37 degrees Celsius, and when you move on to the peripheries, that means the limbs, the fingers, toes, the temperature becomes lesser and lesser. So because of that, these manifestations of cold autoimmune hemolytic anemia is usually seen in the peripheries of the body. So anyway, our brain, the temperature regulation system, tries to maintain our body core temperature. So if it fails, the peripheries will be cold. So this acrocyanosis, or this is Raynaud's phenomena, or this changes of color, skin color according to the temperature, can be seen in peripheries main. Okay, and then as opposed to warm autoimmune hemolytic anemia, cold autoimmune hemolytic anemia is mediated by IgM antibodies. So as you all know, IgM antibodies are capable of activating complement to the up until the membrane attachment complex, that is the last stage of complement activation, and because of that, this cold autoimmune hemolytic anemia can cause intravascular hemolysis. And because of that, this signs of intravascular hemolysis, that means when the red blood cells are broken down inside the vasculature, what happens is that this hemoglobin is released directly into the blood vessels, and this hemoglobin can be filtered through the glomeruli and may appear in the blood. So patient may develop hemoglobinuria, and all the other signs and symptoms of this intravascular hemolysis can be seen in this patient. And then here also they will show a positive direct Coombs test because antibodies are bound. And as similar to warm autoimmune hemolytic anemia, we can classify it as primary and secondary. And primary is idiopathic, secondary infectious mononucleosis, cytomegalovirus, mycoplasma pneumonia, and other viral lymphomas can also other viral infection and lymphoma can also cause cold autoimmune hemolytic anemia. So here you have to remember that these infections. So here in warm autoimmune hemolytic anemia we didn't talk about infections, but in cold autoimmune hemolytic anemia there are infections like mycoplasma pneumonia. Patients can develop cold autoimmune hemolytic anemia, and children can develop paroxysmal cold hemoglobinuria. That means in children, in the nights, patients develop this hemoglobinuria, red colored urine. These children may pass red colored urine, so it is a disease condition. It's a subset of cold autoimmune hemolytic anemia. And there's another disease entity called chronic cold hemagglutinin disease, that is CHAD, which is common in elderly, and it is also type of subset of cold autoimmune hemolytic anemia, which causes chronic hemolysis. So patients may present with anemia. And in investigations, you can see here this direct antiglobulin test is positive, and agglutination of red cells even in room temperature can be seen in vitro. So the important thing you have to remember is in cold autoimmune hemolytic anemia occurs at a cold temperature inside the body, that is in vivo. But when you take the blood cells out of the body and do this test, it can bind to this, it can show agglutination at the at this normal room temperature, which is around 27 or more than 24. So that is one important significance of this finding. And markedly elevated MCV, that is macrocytosis, can be seen, and cold agglutinin test is positive, and autoantibodies can be found for I antigen in the blood. So the management wise, you may first avoid ask the patient to avoid exposure to cold. That means patient shouldn't live in a cold environment. Patient shouldn't take cold bath in water, and these are management wise. And splenectomy has a role in warm autoimmune hemolytic anemia, but here the splenectomy, steroids and chemotherapy are ineffective in cold hemolytic anemia. And if it is severe, and if the patient presents as an acute uh, hemolytic anemia, you can transfuse blood. So while transfusion, what you have to remember is that blood transfusion should be done in a warm environment. And because usually when you transfuse blood, you may transfuse when you go for a massive transfusion like things where this cold body temperature, cold blood products can cause hypothermia in these patients. So it may precipitate hemolytic anemia. So because of that, you have to transfuse warm blood. And here also you can have this altered compatibility testing because of this bound antibodies. So that's all. You can, thank you.